You're tuned into Recovery TV, the voice of hope, with your host, John J. Tassoni Jr. Discussions and information on addiction and mental health issues. Here's your host, John J. Tassoni Jr., with today's guest.
Welcome to another edition of Recovery TV, and I'm your host, John Tassoni. Dr. Tom Pham is in the house, and I want to talk about a little bit about Narcan before the doc takes the stage. Please get it. It saves lives. Everyone should carry this. You never know when you're going to need it. There's two strains now. There's a 400 and an 800. Please get the 800. The 400 is good, but the 800 is better. So thank you. Please get it. Dr. Tom Pham, welcome.
All right.
My friend, thank you for joining us today. You're with BHG. Tell me a little bit about yourself.
All right. Thank you for having me today. So my name is Tommy Pham. I'm the Regional Medical Director of BHG. I oversee Rhode Island. I'm originally a native of Massachusetts. I went to the University of Massachusetts Amherst for my undergraduate studies before going abroad to get my medical degree. I completed most of my training in Chicago and New York. I am now a family medicine physician, board certified. I completed my residency in Northeast Pennsylvania at Geisinger Health System, just a couple hours north of Philadelphia. I was fortunate enough to be able to stay an additional year there and complete my addiction medicine fellowship before coming back closer to home.
So tell me, why addiction medicine?
So during my training, I was fortunate enough to have an experience in a residential program, and being able to see the difference that you can make in patients' lives is really remarkable. Right. From day one that they come in, probably one of the the lowest points of their lives, and seeing the difference that you make when they leave just a few weeks later is absolutely rewarding, and that's my main motivation for staying in the field.
Yeah, well, thank you for that.
Yeah.
I want to talk to you a little bit. We had talked earlier about where you came from, and now you're in Rhode Island, but Philadelphia.
Oh yeah.
It's people think Rhode Island's bad, but a lot of other states are worse off than Rhode Island. There's not a lot of activity after work, so that's how people get hooked on whether it's alcohol or opioids or whatever.
Yeah.
The steel industry in Philadelphia,
yeah.
I'm sure, is one that gets people to do extracurricular activity.
Sure.
And thank God they have someone like you that can go in there and help them and get straightened out a little bit.
Yeah, I mean, it's tough. A lot of the changes that happen in the nation, they come in and you see it first in the Philadelphia area. Xylazine in particular, you see a lot of wounds and complications with xylazine, and now we're starting to see it trickle over towards the Northeast New England area.
Right. Now BHG is a big outfit.
Oh yeah.
How many places do you have?
Yeah. So we have 114 locations nationwide across 22 states. We treat over 43,000 patients daily.
Wow.
Here in Rhode Island, we have 5 clinics that I oversee. They are located in Johnston, Providence, Pawtucket, Middletown, and the Westerly areas.
What kind of services do you provide?
So we specialize in opiate use disorder treatment. We are one of the few providers in the nation that can offer all 3 FDA-approved opiate use disorder medications, those being methadone, buprenorphine, and naltrexone.
Individuals that you treat, is it over 18? Do you do anything with any adolescent kids?
So for the most part, our patient demographic is adults 18 and above. With parental permission, we can treat adolescents. For me, I'm board certified in family medicine. I'm very comfortable with treating adolescents, but for the most part, our patient demographics are adults.
So, one of the things in Rhode Island right now is family medicine, not having enough docs in family medicine. When I first started in this industry, I walk into a family physician place and they say, well, we don't have any patients like that. Little did they know, next thing you know, there was an explosion of adolescent issues. Men, women, children, so it's, excuse me, it's a big issue. It's a big issue. And we're seeing, Rhode Island's seeing a lot of family issues, meaning the dad, the mom, and now it's trickling down to the kids using. You know, whether it's alcohol or opiates or other pills that they're taking.
Yeah.
So it's very complex. It's a complex issue, you know, for a family, and it splits up a lot of families.
Oh, yeah.
You know, because of it. You know. So do you have any thoughts or suggestions for families? Because I have a lot of people watching this show, Doc.
Yeah.
There's almost close to 10,000 on a weekend.
Yeah.
So there's a lot of families watching. What should they look for? Or what should they think about? What should they do? How do they do it?
Sure. So I think the most important thing is just reaching out when you can if you think that you need care, okay? So if you look at the studies, only 25 to 33% of patients that need care for addiction, for opiate use disorder, receive it, okay? So that means about 70% of the patients that need it don't have it. And so a large component of that is access to care, or the stigma and barriers to care. And so, you know, how can we get around that and reach that 70% that, you know, don't have access to care? It's reaching outreach in order to have them reach out, whether it's to their primary care doctor that they trust already, or reaching out to a treatment center like BHG, for example, and getting the answers, or, you know, getting any information that they can in terms of what resources are available to them.
Does insurance play a role?
Yes. So, you know, we think that everybody who needs care should have access to care, and that's why we work with most major insurance companies, whether it's commercial, Medicaid, Medicare. We also have access to grant funding for certain cases. For
Like scholarships?
Not quite scholarships, but the state also provides funding for patients with like limited like insurance or things like that. We also offer flexible pay options for patients who may have no insurance or limited coverage in terms of their insurance.
So what separates BHG from the rest of the 44 agencies that I represent?
Sure. So again, BHG, you know, is only amongst 4% of providers nationwide that is able to offer all three treatment modalities, with those being methadone, buprenorphine, and naltrexone. We also offer wraparound services such as counseling, whether it's individual counseling or group counseling. We also offer case management service, whether it's to connect them with resources available in the community, such as, you know, food, water, shelter, transportation. All of those things are important that, you know, sometimes get overlooked. And the other important part is making sure that we're connected with everybody else involved in the care of the patient. So whether it's primary care doctors, hospitals, correctional facilities, residential programs, being able to ensure that we can give, you know, effective care and continuity of care is extremely important.
Now, if someone comes in with an opioid use disorder, now that you're a family physician, do you or can you give them other alternatives for treatment of their care?
Yeah.
Other than opioid use or alcoholism? You know, can you send them for EKG because of their hearts? Can you send them to diabetes classes? Can you do all that?
And so in our clinics, we actually do EKGs. And so, you know, part of the education process for the patient is being able to explain to them both the risk and the benefits of, you know, whatever treatment that they choose, whether it's methadone, whether it's buprenorphine, whether it's naltrexone. And so being able to educate the patient on, you know, the risk and the benefits of each treatment modality allows them to, you know, really tailor their care to what their needs are. Not necessarily every treatment modality is the most effective for every individual person. And so, you know, easiest examples I can think of is, you know, people who go away for work a week or 2 weeks at a time, maybe methadone isn't the right option for them. Or maybe patients aren't able to effectively dose buprenorphine, or they can't tolerate the taste, so maybe that's not the best choice for them. Or for naltrexone, you know, a lot of you know, aviation industry folks or medical folks may not necessarily be able to be on methadone or buprenorphine in order to continue working. And so, you know, being able to educate them on the risk and the benefits of each treatment.
I don't mean to interrupt you, Doc. We're going to go to break, but I want to talk more about that when we come back, because that's a big issue. You're watching Recovery TV, and I'm your host, Sean Tassone. We'll be right back after these messages.
And now, back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Dr. Tom Pham is in the house, and he's with BHG. So, Doc, thank you for joining us today. Thank you for taking time out of your busy schedule to come in. I want to talk a little bit about your team.
Sure.
You know, I'm all about team. There's no I in team.
Yeah. So our team is everybody in the building, whether it's from the providers, the nurses, the counseling staff, the program directors to our front of office. You know, everybody is involved in the care of the patient. Everybody has different amounts of time spent with the patient, and by meeting regularly, we're able to make sure that the patients are able to get comprehensive care, and that we are looking out for the best interests of the patient.
You know, what you just said, everybody should say the same thing. All about the patient.
Oh yeah.
All about patient choice, and all about the patient. I know we talked a little bit about insurances earlier. The insurance companies now that I've been involved with, the amount of funding that they want to give you to get your treatment is not really where it should be.
Yeah.
They should be giving more. So you're more a productive citizen if you get the treatment you need and get off the opioids or the alcohol. Sure. Would you agree on that?
So in terms of reimbursement, it's definitely a little behind the curve compared to some other industries.
Yeah.
In terms of what we offer, because we are outpatient, in terms of the services that we provide, for patients at least, it's a lot. It's usually often the more cost-effective option if you compare it to like a partial hospitalization program or inpatient treatment. Okay.
But wouldn't you think it make more sense for them to give you more money on the outpatient because it's so costly doing the inpatient?
Yeah, and I think Medicaid in Rhode Island actually just recently increased their rates after
20 years, 15 years.
Yeah.
Yeah. Well, all the rates were increased. Thank God for the General Assembly, because they saw through the smoke screen that the insurance companies were throwing up.
Yeah.
To not give you the amount of money that you deserved. I think at one particular place, every time they saw a patient, they were losing $15.
Yeah.
And during an epidemic, and all the patients that you saw, you were losing $15. I'm surprised a lot of them didn't go out of business.
Yeah.
What about you do anything in Connecticut, Massachusetts, or you just strictly Rhode Island?
I am strictly Rhode Island. BHG nationwide is looking to expand in terms of whether it's Connecticut or Massachusetts. That's to be determined. But as of right now, I only oversee Rhode Island.
Yeah.
Yeah.
And that's enough right now. I mean, a lot of the states now that have organizations like yours in it, I'm hearing that it's a full boat. They're all, not that they're struggling, but there's not a lot of openings because there's so many people, using now both alcohol and substances. The urban areas. I want to talk a little bit about the urban areas. What is your thought on the urban areas?
So, if you look at the Rhode Island Department of Health website, you can see overdose trends, and the highest rates of overdose is concentrated in the urban areas, and so these are the areas that we see most overdoses, where the families are most affected, communities are most affected, and so trying to concentrate some of our efforts into some of these communities likely will give us more of a difference maker in terms of what we can do to serve these communities.
Yeah, I know, like a lot of alerts that I get is Woonsocket, Providence, Pawtucket, Central Falls.
Yeah.
And I don't know why we don't target those facilities or those cities and towns like we should.
Yeah.
But I mean, we're such a small state too. It shouldn't be that difficult. But there's a lot of barriers.
Yeah.
There's a lot of barriers. Cities and towns. Sometimes they don't want the vans there because it gives a bad perception. Yeah. But you know what? If you start losing 7, 8 people at a time, because of a bad batch, and you don't have the medicine there
Absolutely.
to help them out, it could be a tragic problem
Yeah.
for that community. So let's shift a little bit about understanding opioid use and the disorder as itself.
Sure. So to help everybody get like a better understanding of it, it's a chronic condition. It results from chronic exposure, so long time exposure of opioids, whether it's illicit or prescription. You can think of it as it changes the wiring in your brain, those neurons. After long periods of use, your brain rewires itself to expect to feel a certain way, or to not feel a certain way. And so, in order to treat it, it's not something that you can just do overnight. It takes time to undo some of that rewiring, and so that's why it's a chronic condition. It takes very long amounts of time, months, years, if not lifelong treatment.
Well, it's just like with diabetes and other chronic illnesses.
Yeah.
You can't shake it overnight. It's
Absolutely.
a long process to get where you need to be. But luckily, with the new stuff that's coming out, gentlemen and docs like you and ladies that are getting more into the field, there's more help to people.
Yeah.
It's more help to people to understand addiction, understand what it does to your body, and for those people to understand what it does to their families. So I want to talk a little bit more about that when we come back. You're watching Recovery TV, and I'm your host, John Tassoni, with Dr. Pham with BHG right after these messages.
And now, back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Dr. Tom Pham is in the house. Dr. Pham works with BHG. So welcome, Doctor. Again, thank you for coming on. I know you're a busy guy. 7% decline in overdoses in Rhode Island. Why?
So, why? Good question. So, a lot of it has to do with, one, access to care, and two, harm reduction efforts. Okay, harm reduction. So, what does that mean? So, that means more access to naloxone, more access to fentanyl test strips, more access to xylazine test strips, being able to provide transportation and shelter, and all resources available to patients to kind of help them get back on their feet. And so, between 2020 to 2023, there's a slight decrease in overdoses seen here in Rhode Island. Between 2023 and 2024, the final numbers for the 2024 haven't come out yet, but also looks to be coming down even more. If you compare it to national numbers, in April of 2024, there was about a 10% decrease in overdose deaths nationwide. So dropped from about 110,000 to about 100,000. And so, if Rhode Island reflects similar results, definitely we are making progress, and it's, again, likely due to, one, access of care, and two, harm reduction efforts.
Well, I have to tell you, Doc, I want to thank you for what you do, because you're one of the spokes in the wheel. Sure. For young doctors to tackle this. I think it's very much of a win-win for the state, and also a win-win for the patient. To the patients that want to get help, they can get help. Yep. Patients don't want to get help, they don't need to get help. So thank you again for what you do. Thank you to BHG for coming into the state of Rhode Island. My next guest next week is Dr. Skip, and he will be in talking about methadone and Suboxone. And if you see something, ladies and gentlemen, say something. We'll see you next week.